All right. So thank you everybody for hopping on. My name is Jadixa Lopez. I am the Regional Manager for Health Equity and Social Impact. And we are continuing our equity rounds, just giving you snippets of content and education so that we can best treat our patients and understand their backgrounds and where they're coming from. So I want to thank our presenter today for Caring with Pride. We have Kay Muñoz, the Director of Community Engagement from the Health Collective. So thank you, Kay, for coming on and doing this presentation for us today. And I will kick it off to her.
Hi, everyone. Thank you, Yaritza, for inviting me to come today. I've been really excited to come on. Once again, my name is Kay Muñoz. My pronouns are she, they, elle. If you ask me which I prefer, it's anything that comes out of respect. But also you can just call me Kay. With that all being said, I do have a few housekeeping rules. One of them is that you can definitely ask as much questions as you would like. You can drop them in the chat, or you can send them directly to me. Yaritza, if you don't mind, you can definitely share my contact information to everyone. And you already have the presentation, so you are more than welcome to send it to everyone as well to review later. And if you need anything else, let me know. I'm happy to provide that information. Another piece to this is that I like to create spaces of safety even though we are online. So the things that we have conversations over, it just stays here. I do want to be that person that you can share your thought processes with, and at any point in time, again, you can ask questions. So I hope that sounds okay with y'all. In the meantime, I am gonna try to share my screen with y'all. All right. So just a little bit about us. We're going to go over the Health Collective, our team, our mission, sexuality and gender, healthcare in the LGBTQIA plus community, what are pronouns, and I am me, and of course there'll be contact information at the end. So let's get started. Our team is comprised of about 15 individuals. This is just some of our folks. Here you could see our executive director, David Grant, our chief now operations manager who just he got promoted. It's Anthony Delizia. Our dental director, Kevin Hall. Brian Gomes, who is our aesthetics director out of Cromwell. Maria, who's our director of development, myself, and then Barry Walters, who's the Health Collective East site director. And then the rest is from our medical and dental services, where we have our clinic manager, Miguel, and our services manager on the dental side, Ruth Murray. So before we get onto this piece here, I do want to say that the Health Collective is one of the oldest nonprofits here in the state. We began based off of volunteers, nurses, who were testing individuals in the midst of the HIV/AIDS epidemic. We are the first organization to provide dental care services to the people who have HIV or AIDS, but we also provide dental care to anyone now in the community. We don't accept insurance on the medical end, but on the dental end we do. And if you don't have insurance, we do a sliding scale situationship with folks. So if you know individuals who don't have insurance and need affordable care, we do provide that. And so with that all being said, I do want to just start by defining sexual orientation. And sexual orientation is defined as whom an individual is attracted to. So for example, a transgender male can identify as a straight person or a gay person. So a transgender male is essentially female to male. And then a transgender woman is male to female. And they can also identify as either a straight person or as a lesbian. Your sexual orientation does not have to correlate with your physical gender. And the history of the acronym, right? The acronym LGB was used prior to the 90s. LGB replaced the term gay for the community around the mid-1980s. And since the 90s, the acronym has evolved to the LGBT, and this is what we have seen recently. So this version is still okay, but then you can also use LGBTQIA+. Sometimes you'll see two-spirited. But do any of us know which what the letters mean in the acronym? We can just call it out. It's fine.
Lesbian, gay. Oh, I'll let somebody else answer.
John?
Bisexual,
Bisexual,
transition.
yep.
Transgender, yeah. So
Questioning. Yeah.
questioning, yep.
Yep.
So the Q is a double one, so it could be queer or questioning. So it's lesbian, gay, bisexual, transgender, queer questioning, intersex, asexual, two-spirited, pansexual, and the list continues, right? But this is the gist of it. And I put pansexual on the bottom because I feel like it's kind of metaphoric to the fact that like pansexual individuals, they are about everybody. They play for every team, right? So I definitely wanted that to be a little bit symbolic, but great job, everyone. So in the community, there is this new definition, which is SOGI, right? Because we all have a SOGI, even if you're not a part of the community. So everyone has a sexual orientation, everyone has a gender identity, and everyone has a gender expression, which are characteristics common to all human beings. Everyone has them, again, and it's not just people within the LGBTQIA+ community. So it's like race, it's like ethnicity, class, disability, and age. SOGI is an important part of a person's identity, and it impacts how people experience themselves. Each person is unique and has multiple layered aspects of their own SOGI. So here's a little bit of a breakdown. So it's like sex is based on your biology, like chromosomes, hormones, and anatomy. So you think about intersex individuals, females, males. And then gender is a sociocultural system and beliefs labeling a person based on a binary spectrum and characteristics perceived as masculine or feminine. And then your gender identity is a personal sense of one's own gender or lack thereof, an internal perception or knowledge based on how much a person aligns or doesn't align with their understood gender options. So for example, there's non-binary individuals, there's gender queer people, there's people who identify as cisgender, man, woman, transgender, and so on. And so gender expression, right? So your gender performance or presentation is how one chooses to express their gender and or be perceived as either masculine, feminine, androgynous, or none of the above. And then there's your orientation, which is, again, your romantic and or attractions to people. And then your sexual behavior is like how you engage in a variety of with individuals, ranging from activities done alone or to acts with other people. Are there any questions on this? All right. I do want to actually take a second to also define ACE and ACE-SPEC because this has come up in previous conversations. So ACE is shorthand term for asexual, and asexuality refers to a lack of or minimal sexual attraction. People who identify as asexual may or may not experience romantic attraction and engage in romantic relationships. And ACE-SPEC stands for asexual or aromantic spectrum. It's an umbrella term for individuals who identify on the asexual and or aromantic spectrum and encompassing a wide range of experiences related to sexual and romantic attraction. So asexual, once again, just bringing it in, is like it refers to individuals who do not experience sexual attraction to others, but they can participate in romantic relationships. And aro refers to individuals who do not experience romantic attraction to others. And then, of course, the spectrum, right? A-spec encompasses a wide range of experiences from those who feel no attraction to those who may experience attraction under specific conditions. And then there's variations. Within A-spec, there are various sub-identities, such as demisexual, gray asexual, and others, which describe different levels of types of attraction. And then community usage is A-spec is used as a general term for anyone who falls, again, within the asexual and the aromantic spectrum. So honing it in, right? We're defining gender. Gender includes a social, psychological, cultural, and a behavioral aspect of being a man, a woman, or any other gender identity, right? Those who are outside of these groups fall into the category of being non-binary. So for myself, I identify as any pronoun so long as it comes from respect, right? So I would not be offended if you were to say she is over there, like Kay is over there, or he is over there. To me, it doesn't matter because it feels affirming regardless, right? So whether I am they, she, elle, her, it all feels right to me as a genderqueer person. So here's a little bit of that conversation, right, that we're having. And it's like, again, non-binary. That is an individual who feels neither masculine or feminine. And ambigender, when two genders are experienced at the same time with no fluidity. And transgender, when one sex does not register with one they were born with. And cisgender is when an individual aligns with the sex that they are born with, right? I do want to also pause here because people who are part of the umbrella of being transgender, they don't have to transition in order to be a part of the community, right? So if an individual were to come in and say, my pronouns are she, they, or she, her, hers, but they have a masculine appearance, you go by their pronouns that they have provided for you. Because just because they haven't transitioned, it doesn't mean that that's not who they are. The point here is that when somebody tells you who they are, it's to believe them, right? And that's how we care for people. And just a few things here. The colors that represent the LGBTQIA plus are known as the rainbow, meaning that every color has its own meaning for each member of the community. Each particular acronym has its own symbol as well. And the community is ageless. There's this perceived notion that there is not many older people in the community. However, they do exist. And they are also managing their own stigmas as well, especially those who live through the HIV/AIDS epidemic, and there is a bit of survivor's guilt, but also the joy that comes from that, because when young people see older LGBTQIA folks, there's that silver lining, that joy. And then the community needs allies, and whether you believe it or not, if you're an ally, you're a part of the community, right? So that's always important to remember. We hopped a bit. Sorry, y'all. All right. So healthcare in the LGBTQIA plus community. So why the awareness matters. Healthcare equity in the aging community, individuals may avoid care due to past discrimination. Providers must be trained to offer inclusive, affirming, and culturally competent services. There's also housing discrimination. Many face barriers in long-term care facilities or senior housing. Nearly half fear being mistreated in care facilities. And then mental health impact. There's high rates of depression and anxiety among the LGBTQIA plus elders, but there's also high rates of depression and anxiety for younger folks as well. And the policy and advocacy needs. Few programs are tailored for aging LGBTQIA plus individuals, and there's so much more for younger people in certain states. We are fortunate that here in Connecticut, we do have protections and we are allowed programming for younger people, but there's not enough either, right? So visibility and policy inclusion are very, very critical across the spectrum of age. So why LGBTQIA plus awareness in healthcare matters? Well, there are health disparities that exist. People within the community have experienced higher rates of HIV, depression, anxiety, substance use, and suicidal ideation. There's discrimination that impacts the queer community and their health, which is over 56% of LGBTQIA plus adults report discrimination in healthcare settings. And then transgender individuals often avoid care due to anticipated stigma or past mistreatment. This is a very interesting piece here because not many doctors' offices know how to care for trans individuals, especially for folks who have gone from from female to male. Like if they still have specific parts, like their genitals are still whether it's still a vagina or they have transitioned to having a penis, they still need to get a pap smear, right? That's still necessary. Trans men still need to get cancer checkups for their breasts, because even though they might not physically have breasts, they still have to get that checkup, right? It's not something that just instantly goes away, because even cisgendered men can have breast cancer, right? So the data gaps that lead to misrepresentation. So it comes back to, ironically, SOGI, right? The lack of SOGI data collection and EHRs results in underrepresentation and inequitable funding. And the benefits of LGBTQIA plus inclusion in healthcare is that it improves patient outcomes, it supports public health equity, it meets ethical and legal standards, and bottom line, it's awareness. And it isn't just about being respectful, it's also life-saving, right? I do hear that someone was unmuted. I can't see you, but is there a question? All right. And so how health providers can support LGBTQIA plus patients. So it's utilizing inclusive language, right? Ask for and use correct names and pronouns, right? I always say that the rule of thumb is that if you have forgotten the person's pronouns, you can always utilize their name. Avoid assumptions about relationships, bodies, or sexual behavior. Training staff, these moments right here are so crucial, right? Because when we provide ongoing education to the LGBTQIA plus community, it addresses the health disparities, the history, and how to provide affirming practices, right? And it includes bias training to reduce microaggressions and stigma. And then updating intake and health records, right? Incorporate SOGI data collection to the forms of your EHRs. Ensure privacy and sensitivity around sharing identity information, and creating a welcoming environment, like by displaying inclusive signage, if that is something we choose to do, or offering gender-neutral bathrooms and ensuring non-discrimination policies are visible and enforced, right? Commitment to inclusion leads to better care, safer spaces, and a stronger patient trust. And now, segueing to pronouns, which is perfect, right? A fun fact about pronouns is that there are over 100 pronouns. The good thing about it is you don't have to learn them all. So here are a few examples. So as you know, what is a pronoun? It is a word that is used instead of a noun or a noun phrase. Pronouns refer to either a noun that has already been mentioned or to a noun that does not need to be named specifically. We're going to touch a bit upon implicit bias. LGBTQI plus pronouns have helped establish how an individual sees themselves, and it differs from their outside appearance. right? As I mentioned earlier, there could be an individual who they identify as she, her, hers, but their appearance doesn't physically match their pronoun, and that's okay, right? And inclusivity. Using an individual's preferred pronouns can make them feel safe when they are within the workspace, or in any environment. If you have ever been in a situation where you do not want to ask someone their preferred pronouns, you can always utilize yourself and say, hi, my name is, insert your pronouns here, right? And it's a safe space, right? In some cases, not everyone is okay with using their pronouns that do not align with their beliefs. In instances like this, call the individual by their name so both parties respect each other's boundaries, because that's also important. And again, here's the list of self-identification. Some folks may or may have not seen the list before. So we have our he, him, his, she, her, hers, they, them. In Spanish is elle. Then we have sie, her, hers, they, her, their, theirs, and they, them, their, right? So these are about a few variations of the pronouns that some individuals will use. But again, some folks might not. I know an individual who their pronouns is per, pers, and that's how they go by, right? And it's difficult in the beginning, but it's again like practicing. Practice makes perfect. And again, just honing in on what gender identity is, right? It's important to remember that gender, like sexuality, is a spectrum, right? Gender and sexuality are a social construct, and we tend to believe in the binary, while as LGBTQIA folks may fluctuate from that spectrum and that binary, and that's completely okay. And then I am me, right? What this means is that a person's sex at birth may not correlate with what they identify as of right now. And also, that can be rather okay. Some folks feel more affirmed in their gender identity by wearing different types of clothing, wearing makeup, not wearing makeup, cutting their hair, not cutting their hair. People find affirmation in different ways. And there's a difference, right? There's a difference between a pronoun and gender identity, and it does not have to be gendered, whereas an individual's gender identity correlates to gender. And I'm gonna leave this space for questions. Ooh, I'm gonna go into the chat, so I'm sorry, y'all. Two questions. What are some respectful and supportive ways to a person that can explore questions around their gender identity or sexual orientation, especially if they're unsure, fearful, or don't have anyone in their life they feel safe talking to? That's a good question, right? Because there are still some individuals who are not out to their family members or their community. Always affirm to the person that you are not going to share any of this information outside of the walls, right? Something about safe spaces is that the term has been in many ways polarized, right? But we all need safe spaces, and it begins with us. We are a safe space. Places and environments become safe when we are projecting that safety, right? So always reminding a client that, like, I will not contact anyone unless you want me to, right? And reaffirming to them that, like, I need to know these things in order to know how to best assist you, right? So whether that is like getting them tested, for example, or whether that is providing them the adequate care for whatever it may be. Like, it's always bringing it back to, in order for me to assist you, I need to know these questions, so you can also provide the space for them to talk or be able to sit in silence for a little bit. Now, I understand that's really difficult, especially in a medical space, because there's certain time restrictions that you guys have. But when you take time with clients, that builds that trust, right? And being able to be that support that at the time some individuals haven't had at all, right? And the second question is that as an organization, how can we make sure people know where to find trusted resources? You can always put outside on the lobby area some pamphlets. Like, we do have pamphlets. You can always request pamphlets from us, and you can place them in the waiting room. We also have an online website where we have like resources that we could provide, and also getting folks in contact with nearby pride houses or LGBTQIA houses. They also provide support groups. They provide community groups, and just getting folks connected to community is also so important. So whether that's requesting pamphlets, whether that's directing them to a website, that is all like really good in terms of providing reputable resources. So because, and Yeritza, correct me if I am wrong here, you're located within the Waterbury area, correct?
Well, right. So Waterbury Hospital is in the Waterbury area. We have Rockville over in Vernon, and we have Manchester Memorial located in Manchester.
Okay, so I'm going to start off based off of Manchester. So Manchester, you would have us, the Health Collective, right? And also Waterbury can utilize us as well. But in Waterbury, they actually have the Waterbury Pride, and they are a collective of individuals who assist to put on Pride events. But I am sure that they also meet afterwards, and they just don't do the Pride events. But for the Waterbury area, you would have the New Haven Pride Center, right? So that's also a space where individuals can go to, and they offer similar resources as we do, right? So the Vernon, Manchester area would have the Health Collective, and the Waterbury and Greater New Haven area would have the New Haven Pride Center and the Waterbury Pride Festival individuals. Are there any other questions that I may have missed?
So I'll ask one real quick. So I know that some of our staff have to ask questions related to somebody's identity, such as just their gender. If a question triggers a particular patient, how can we get that patient back to understand that the question was not asked because we couldn't identify you visually? It's because we need to ask this question. How can we bring that conversation back?
Yeah, so typically what we have done within our clinic is that we just say, hey, I'm sorry, this was not meant to offend, addressing it right away, but also letting them know this is what I need to ask, and showing them the documents, right? So that's what we tend to do. Like, we have like a virtual document, but then we also have a physical document, and we will show our clients the physical document that we have to ask those questions in order to ensure that we are, first of all, addressing them correctly and understand how we can best assist them. So that is a simple way to do it. But I also understand that at times that's that lack of trust, right? So it's gonna require a lot of patience. So again, understanding that there are at times time restrictions within visits, but also allowing that person to, first of all, express themselves real quick, and then also reeling them in and saying, hey, I'm sorry that this must have triggered you in any way. I have to ask these questions. This is what's on my documentation. And that tends to bring people in. But again, some people are different and they might require more time. I see 2 hands up, and I believe Ashley was first, and then afterwards I have John.
John, you can actually go ahead. You were actually first, so you can go first. I'll go second.
Oh, that's okay. I had a response to Nina. It's not only about where they can find the trusted resources, it's about who they can talk to also that they can trust. My sister works at a hospital in Pennsylvania that they actually have pins that they wear saying they're an ally or they're a safe space or they're someone safe that they can talk to. That we could always look into even for our organization.
Love that. Thanks, Sean.
Okay, hi. So this is actually not related to patients, but more so related to being respectful of how employees identify. So of course there are certain guidelines that we may need to be required to follow. So if somebody identifies by a different name, we approach it to the best of our ability. But is there a best way that we should be explaining our reasoning, or just to make sure that we are respecting them? So if we, for example, if we have to put a legal name that they may not go by, they prefer to go by a different name, but on, say, a badge, we have to put a legal name for purposes. Is there a best way to kind of handle those situations or approach those?
Yeah, so actually we've recently, one of my staffers, they had a dead name, which is their legal name, right? And on our legal documentations, first of all, we did not want to put their non-chosen name, but we had to for record keeping. And we explained the process that, hey, for example, paychecks, we have to be able to put your legal name. But on your emails, we will put the name that you prefer, right? And we will always introduce you as the name that you prefer. And our website, we will put the name that you prefer, right? So it's also like letting the individual know that like on legal documents, unless like your name has officially changed, then we have to put the name that's on your legal ID. And the individual took it well. But then once they changed their name, we instantly changed the back end as well. So it took a while too. And with the current administration, it's kind of really difficult now, because if people are going to use their license or change their license, unfortunately, their sex is not aligned with their gender, right?
Right.
So that's going to be a little difficult. And that is kind of like the barrier that we have come across with individuals. Like some folks are actually holding on to their dead name because they don't want to have an ID that doesn't correlate with how they present now, right? But we have been rather sensitive, and where we can actually honor their names, we were able to do that. So it's also finding those spaces as well.
Okay, perfect. Thank you so much. That was very helpful.
Yeah. Any other questions? All right. If there aren't any other questions, I'm gonna drop my contact information in the chat. I've had a few folks like that, they'll ask me like about what reading materials that they could have to practice like how to be a better ally. And I've always sent out some reading recommendations or some sites to follow. And John, I do see your hand up.
Yeah, I just wanted to mention.
Oh, you muted yourself.
Oh, okay. I'm very familiar with the Health Collective. I've volunteered there. I belong to an organization where we've done fundraisers to raise money for you all. I think you all are an amazing group that's necessary. I remember when they used to come out to the bar and did HIV testing. It's just a wonderful organization.
Yes. Thank you so much, John. And ironically, we still go to the bar and do testing. If some of y'all are within like the Hartford area, at the end of the month, we're going to be in Parkville for their Pride Night, and we're going to be doing some free testing. So if you just want to stop by and say hello, you definitely can. It's always great to see people who have volunteered with us come back around. So thank you, John.
That was wonderful. Thank you so much, Kay, for all of your time. It was very, very informative, and she's going to be available for you guys via email if you have any additional questions that you didn't feel comfortable sharing with the group. I just want to make sure that everybody remembers that being respectful to everybody is one of our service values. Actually, service value number 3 is I will foster an environment where everyone is welcome, respected, appreciated, and able to be themselves. So creating a safe space for our patients is part of our service values. And this is just a continuation on that. So thank you so much, Kay, for everything that you do. And thank you everybody for joining and learning. These recordings will be available later on, and I will make sure to share the presentation deck. I hope everybody has a wonderful day.
Thank you all so much.
Yeah.
Have a great one.
Thank you, Kay.
Thank y'all.
Thank you.